Jim and Pat Ratliff had a 54-year love story.
We were just attached at the hip.
Through ups and downs, including Pat's breast cancer more than a decade ago, which is why she was so diligent about screening and concerned when she noticed changes in her other breast. She had imaging at a nearby hospital, part of NAH, Northern Arizona Healthcare.
And they told her what?
They couldn't find anything.
Eventually, Pat saw breast surgeon Beth Dupree.
I literally couldn't believe what I was seeing. It was screaming cancer.
Advanced breast cancer. 2 years later, Pat was gone. Dr. Dupree had just moved to Sedona to develop a state-of-the-art breast center at NAH. Pat was just the first patient, she says, who came to her with a cancer missed on previous scans.
These were misses that were not subtle.
The hospital has an exclusive contract with Northern Arizona Radiology. Dupree, who says she continued to flag misread mammograms, pushed them to hire dedicated breast imagers, including Mike Ulysses, who couldn't believe some of what he says was missed.
I said, my God, Beth, that's the size of a tangerine. I don't understand how they can call it normal.
The hospital requested the radiology group have those new breast imagers review more than 6,000 patients whose scans had initially been read by a particular general radiologist. Ulysses says they found cancer in an additional 25 women.
The recommendation was returned in a year.
Among them, Christy Gallo.
My question was, how could I go from normal to having 3 tumors in 1 year? That didn't make sense to me.
Dr. Dupree believes the number of patients with missed cancers was much greater than the 25 detected in the review. She made a poster with all of her patients whose diagnoses she says were delayed, hoping to show it to the hospital board. We're only showing those who gave us permission.
It must be hard to look at their faces.
It is.
NBC News obtained an email from one of the breast imagers to the radiology group sent before the review was complete, warning of the gravity of the situation. After the review, there was still concern.
We thought that there were a significant chance that additional patients were in harm's way. We needed to expand our investigation.
But Dr. Ulysses says the radiology group did not. In a statement to NBC, NAH points out the radiology group is a separate entity and says in part the hospital quickly acted to address these concerns. We ensured these mammograms were reread specifically by a team of breast fellowship-trained radiologists, saying very few required any follow-up. And since this review, all mammograms are read by specialized breast radiologists. The hospital's chief counsel spoke on a Zoom with community advisors.
So the quality process worked. There was an error. We're humans. Doctors are humans.
They messed up, and they don't want to fess up to it.
Northern Arizona Radiology called the review results well within national standards. In a statement, it says all radiologists are board certified and meet all requirements, including those under the Mammography Quality Standards Act. Dupree and 3 out of 4 new breast imagers, including Dr. Ulysses, have now left. NBC News has learned the general radiologist who was the subject of the review is now working in another state. As for Gallo, her cancer is in remission, but she's not sure the questions will ever go away.
Maybe if they had caught it sooner, it could have been just a lumpectomy instead of a whole mastectomy choice, but I didn't get that choice.
Operating room here.
Kristen Dahlgren, NBC News, Sedona, Arizona.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.